Welcome everyone. Today, we're cracking open what I like to call the ultimate guardian's guide to health data. Look, if you're a clinician, a coder, or a clinical documentation integrity pro, you already know that safeguarding patient information is just as critical as the clinical care itself. In this explainer, we are going to completely decode the legal frameworks that govern our daily documentation and data handling. We're taking the heavy, sometimes intimidating legalese of HIPAA and translating it into clear, actionable strategies. So get ready, because we're going to master the rules that protect both our patients and our practices.
Here is our progressive blueprint for today's explainer. We'll be covering 1. The scope of HIPAA. 2. PHI and covered entities. 3. Rules of use and disclosure. 4. Patient rights and minors. And 5. Security safeguards and penalties.
Okay, let's dive right into Section 1, the scope of HIPAA. So let's look at the macro-level architecture of the law itself. There's actually a lot of industry confusion about what HIPAA really covers, and honestly, it helps to understand the divide right out of the gate. Enacted back in 1996, HIPAA is split into distinct titles. Title I, that's all about health insurance portability. This is the part that protects workers and their families when they change or lose their jobs. It limits exclusions for pre-existing conditions and guarantees renewability. But when we as healthcare professionals talk about HIPAA compliance, we're almost always talking about Title II. Title II focuses on administrative simplification, meaning it mandated standardized electronic formats for billing and claims just to reduce costs. Crucially, it established the privacy and security rules to protect that electronic data, which is exactly what we have to focus on every single day.
Moving right along to Section 2, PHI and covered entities. Now that we know exactly where the privacy rules live within the law, let's pivot to defining the actual treasure we're guarding and identify who holds the legal responsibility as its custodians. So what exactly is the treasure? Well, it's protected health information, or PHI. Now what's really interesting here is that PHI isn't just your medical diagnoses or lab results. It encompasses literally any individually identifiable health information relating to a patient's past, present, or future physical or mental health, the provision of their care, or the payment for that care. That means basic demographic data. We're talking a patient's name, their home address, a social security number, or even something like a license plate number. They all count as PHI if they are connected to healthcare provision. If a piece of data could reasonably allow a person to be identified in connection with their health, it is strictly protected, no exceptions.
So, the privacy rule applies specifically to covered entities that transmit medical information electronically. There are three primary categories here: healthcare providers, like your doctors and clinics, health plans, like Medicare, private insurance, and healthcare clearinghouses that process billing and claims. But it doesn't stop there. What about all those outside agencies that help us run our facilities? These are our business associates, agents performing functions like medical dictation, accounting, or legal services. Now, while they aren't covered entities themselves, covered entities must have strict binding agreements with these associates, ensuring they handle PHI according to the exact same federal privacy laws. A breach by a transcription service, that's treated just as seriously as a breach by the hospital itself.
All right, let's look at Section 3, Rules of Use and Disclosure.
Okay, so we know what the data is, and we know who's guarding it. Now let's introduce the operational rules of engagement. When can health data flow freely, and when does it need to be locked down? First, we have to mentally file a really critical legal distinction: use versus disclosure. Use of PHI refers strictly to sharing and utilizing that information internally within your specific covered entity, like consulting with a colleague down the hall about a difficult case. Disclosure, on the other hand, is when you release PHI outside of your entity for external purposes, like sending records to an external specialist or an insurance company. This distinction right here is the absolute foundation of how the privacy rule regulates the flow of information.
So when do you actually need a patient's permission to share their data? Well, for routine operations, categorized as TPO or treatment, payment, and healthcare operations, you require absolutely no patient authorization. This means everyday clinical tasks, case management, consulting with another provider, or sending a bill to insurance can all happen seamlessly. This is designed to prevent bottlenecks in patient care. However, sensitive scenarios demand a formal lock and key. Releasing PHI to a life insurance company, a lawyer, or for any marketing purposes absolutely requires specific, written authorization from the patient. And sensitive PHI, things like HIV status, substance abuse, or mental health records, carries the tightest restrictions of the whole shebang.
Let's shift perspectives in Section 4, Patient Rights and Minors.
We've spent time looking at our responsibilities as providers, but let's shift to the patient's power. HIPAA grants patients some very serious legally protected rights over their own medical records. First up, they have the right to inspect and obtain copies of their medical records, with very few exceptions, like psychotherapy notes or info compiled for a lawsuit. Second, if a patient believes their record is inaccurate, they can request an amendment. Now, a provider can decline this request if they believe the record is already accurate, but the patient still retains the legal right to submit a formal statement of disagreement, and that statement must be included in the permanent record. Finally, patients can request an accounting of disclosures. Basically, they can ask, hey, who's my data been shared with in the last 6 years? Excluding, of course, those routine TPO disclosures we just talked about.
Now, this brings us to a really fascinating and complex legal question. When do minors control their own protected health information? Usually, we know a parent or guardian makes healthcare decisions and controls the data. But are there exceptions to this rule?
The answer is yes, absolutely, and it's a critical one for clinical documentation. The privacy rule outlines specific legal carve-outs where a minor can actually obtain care without parental consent, and therefore that specific PHI regarding their care is kept strictly confidential from the parents. These scenarios typically include things like pregnancy-related care, treatment for communicable diseases like STDs, and substance abuse treatment. However, it is absolutely vital to note here that HIPAA largely defers to state laws regarding minors, so providers must always be aware of their specific local statutes when navigating parental access.
All right, bringing us to our final leg, Section 5, Security, Safeguards, and Penalties. We are now entering the high-stakes climax of our explainer. We've covered privacy, but what about security? Well, the security rule mandates that covered entities build a fully compliant digital fortress, and it requires 3 mandatory pillars to do so. Step 1, administrative safeguards. This is the human element, folks. Training staff, establishing clear policies for authorized access, and having a solid disaster recovery plan in place. Step 2, physical safeguards. This literally means limiting physical access. We're talking keeping unauthorized eyes off screens in high-traffic areas, utilizing locking doors, and strictly securing portable devices so a laptop isn't just stolen out of the backseat of a car. Step 3 is technical safeguards. This is your software armor, requiring secure passwords, utilizing firewalls, automatically logging off unattended workstations, and encrypting data so it's entirely useless even if it does get intercepted. So, why does this digital fortress matter so much? Because medical records are incredibly lucrative on the dark web. They often sell for much more than a stolen credit card number, and the penalties for failing to protect them are severe. Look, mistakes happen, and standard civil penalties for failing to follow the rules can result in fines up to $100 per violation, capped at $25,000 a year. But contrast that with the criminal penalties. If an individual or entity knowingly obtains or discloses PHI with malicious intent or for commercial or personal gain, like, say, selling patient data, the stakes skyrocket. You're looking at massive fines up to $250,000 and up to 10 years of imprisonment. This isn't just administrative red tape. It is federal law with some serious teeth.
We've covered a tremendous amount of ground today, from the macro scope of Title II all the way down to the micro details of technical safeguards. I want to leave you with this one final, crucial thought. Compliance is not an administrative burden. It's a fundamental, legally mandated component of patient care. Every single time you log in, every time you document, you are acting as a guardian of your patient's most sensitive information. So ask yourself today, is your documentation practice a fortress or is it a liability? Thank you so much for joining me on this explainer, and please like, share, subscribe to Decode Healthcare with Harshal.